fibroids. What can you do to take care of them, treat them, make them better? Hi, I'm your local OBGYN. I love women, and let's talk about what we can do to improve your symptoms of your fibroids. So fibroid symptoms are usually either they're asymptomatic, they cause heavy bleeding, they cause discomfort, or they cause pain from the sheer size and volume of them. They can also increase fertility issues depending on where they're located. That being said, there's a variety of treatments. If it's just crampiness and annoyingness, you can just do Motrin and things like that. Obviously, if there is significant bleeding, some people will go on hormonal birth control or they'll get an IUD. There is a class of medications that affect sort of our hormonal axis and kind of turn down the hormones, decrease the bleeding and the growth, which can sometimes then decrease the size of them a little bit. There's also injections called Lupron, which are basically a medication to turn the hormones off, which then subsequently nourish the fibroids so that you can decrease the flow, growth, and bleeding that's associated with them. If it's a bleeding issue, there's even oral medications that you can just take as needed to slow down the bleeding in these particular scenarios. If we're starting to talk about slightly more invasive options, you can do something called a uterine artery ablation, which slows down the blood flow to the fibroids. And if you slow that down, you tend to slow the growth and bleeding. Or there are these new fancy MRI ultrasound guided frequency things that can be done to slow them down, shrink them down, and hopefully make them less of an issue. Otherwise, there's something called a myomectomy where they're shelled out. We kind of make Swiss cheese of your uterus, put it back together. We usually do that in the setting where you want to preserve your uterus for fertility. And then obviously there is a hysterectomy to just take the whole darn thing out.